We are here at the National LGBT Health Summit 2012.
It is an honour and a privilege to welcome you all to the 7th Annual LGBT Health Summit.
I wish the summit every success and declare it open.
We're looking at addressing the wider issues around health, equality and sexual orientation and trans issues.
Let's not just talk about sex, but let's not talk about sex.
I think it's really inclusive of LGBT, which makes a real difference. I think that bisexual and transgender people are often kind of overlooked.
This is the biggest ever summit.
Everyone's so equal here, it's fantastic.
It's all about networking and learning from other people.
In an LGBT conference like this, there is a feeling of belonging before you start.
I just feel like, I'm not on my own. There are other people out there, doing similar strands of the same stuff.
Well, I think it's got a really great atmosphere and you've got a really broad spectrum of people.
There's a variety of speakers, sharing presentations and workshops, kind of seeing how we can support each other, develop ideas to kind of advocate for the rights of LGBTQ people in getting the health they deserve and the health services they deserve as well.
Here the debate is very focused on, okay, so this is what the LGBT experience is, how do we impact on national policy to make a difference? And that's where I find, coming from the department, I can connect with what's being said.
It's important that heterosexual people come along here because oftenly, sadly, we're the people in power. So therefore we have a responsibility to ensure that we learn and empathise with the experiences that other people have.
If we can get LGBT people voicing their demands for services, we can begin to make sure that NHS and specialist services are truly responsive to those needs.
Statistics stacked against us, focusing on testing and treatment, but what about those who want more?
The aim of an event like this is to make sure that services are accessible and appropriate for the people using them.
For me, it's a couple of days to focus on the health implications of being LGBT.
They're really important opportunities for people to share evidence, to share best practice.
The thing that's amazed me today has been the depth and the quality of really, really up-to-date research.
These little things all put together make a more inclusive society, I would have thought.
It's a bit of a boost to carry on doing what you're doing and keep at it.
Celebrate what we have achieved and look forward to achieving more together in the future.
It's been absolutely inspiring and very moving.
What's the recipe for equality? It isn't rocket science. Look at the services you offer and see what boxes they tick. Like the ingredients of a balanced diet, we need them all.
There was barely a dry eye in the House at the end of the plenary, at the end of our second day. And I've never seen anything like that happen in a plenary before.
The point of meetings like this is people come together and hopefully at the end of the conference go back into their communities, go back to their workplace, go back to their families, enthused and ready to keep the campaigning and struggle up once again.
It really means a lot to us that she was here and that she made her first public speech about LGBT health, and we were privileged to have her here to do that at our conference.
Being a visual artist and all of that. And I love this logo, isn't it beautiful? And so I just thought I would be for you this morning. I
want to thank the Metro Centre for allowing us to be involved and facilitating our contribution.
I think this summit has had a really amazing atmosphere.
Thanks for organising a great summit, it's been really enjoyable.
I'm really proud of what we've achieved. It's been an incredible experience and I feel overwhelmed and really, really happy that it's been a success and proud in a million ways.